back here at 924. The month of September is nationally recognized as Gynecologic Cancer Awareness Month.
And in honor of this, we wanted to consult with a local physician on screening and how to lower risk of the disease.
So joining us now is Dr. April Miller. She's a gynecologist with Atrium Health Wake Forest Baptist. Good morning to you.
Good morning. How are you doing?
We are great. Thank you so much for being with us. So let's start off with the basics. What are the gynecologic cancers? How common are they?
Yeah, there's multiple gynecologic cancers. The most common of which is cancer of the uterus of the womb, or when a woman gets pregnant where the baby lives. That's the most common one in the United States, followed by one ovarian cancer, which people have heard about, cervical cancer, and then less common are cancers of the vagina and the vulva.
Okay, and Dr. Miller, thank you for explaining those common cancers. What about risk factors here across the different types?
So again, uterine cancer, cancer in the uterus, is the most common one in the United States. A big risk factor for that one is obesity, which is having a BMI of 30 or more, as well as being older than age 50. Next up would be cervical cancer. Cervical cancer is luckily the one gynecologic cancer we can actually screen for. That's what's in your Pap smear, so risk factors for that. Big one is that HPV, which is human papillomavirus, as well as cigarette smoking, as well as not getting your regular recommended cervical Pap smears.
It's nice. Oh, sorry to interrupt. Continue.
Oh, no.
Well, I was just going to ask you that so many of these cancers often go undetected, and that happens a lot for women. What are some signs that women should be looking out for and when they should seek a physician's assistance?
So a big one is abnormal uterine bleeding, or bleeding that's just not normal for you. So any woman that's been through menopause, which is when you've had no periods for a year, if you all of a sudden start bleeding, you really want to see your primary care doctor or your gynecologist for that, because that is not normal. That's a really big symptom of cancer of the uterus, as well as some of the other cancers as well.
All right, what about lowering chances of contracting any of these gynecologic cancers?
Of course. So for things like cancer of the uterus, having a healthy weight, and exercising, having a healthy diet can really help. For things like cervical cancer, getting your Pap smears per the recommended screening guidelines, and things like ovarian cancer. Unfortunately, that is one that's a little trickier. There is no screening for it, but of course, having again a healthy diet, a normal weight can also help, as well as breastfeeding can also help decrease the risk of ovarian cancer as well.
And again, this is Gynecologic Cancer Awareness Month. Are there any kind of conversations that you're having with your patients right now, or any reminders for our viewers at home that you want them to focus on for this month?
Of course. So for cervical cancer, definitely I talk to all my patients about getting their regular scheduled Pap smears. And that is in different guidelines. Historically, it was always every year, but now it's about every 3 to 5 years. And then for all the other ones, unfortunately, there is no screening test for it. So the best thing for a person to do is listen to your body. Talk to your provider if you have any abnormal vaginal bleeding or discharge, any pain or like fullness in your belly or pelvis. Don't be afraid to make an appointment and just ask.
Thank you, Dr. Miller, for this valuable information. We appreciate your time this morning, and this interview will be available on triadcw.com later this morning in case you missed anything.